At the Minneapolis Health Department, we initiate programs, policy, and partnerships to improve the quality of life for all residents. A large percentage of the community clinic patients are uninsured. And the community clinics in Minnesota don't get any kind of reimbursement for dietitians or certified diabetes educators or community health workers. We are supporting our clinic partners in implementing new approaches to patient care and diabetes education. And we are innovating with new partnerships with community agencies to help patients address social needs. The approach is to support our clinics in enhancing diabetes care within the clinic and then helping patients address social needs and self-management support outside of the clinic. One of our clinics has added a certified diabetes educator. Another clinic is experimenting with a shared medical visit model. Two of the clinics are referring patients to community health worker services. They are all systematically identifying patients' needs, screening patients for their social needs, and then making referrals to different agencies to address them.
We need extender type of services to help us look at the patient as a whole and not just one aspect of their care. The value for patients is that it has brought a needed resource to them. You come to your health center, you get to see your doctor, you get some education and nutrition, and when you leave, you are connected with someone in the community who can continue to follow you along the way, helping you meet your healthcare goals and your social needs. One of the biggest barriers for clinicians is time. And so our visits are very limited and we have to address multiple needs for the patients. The Bridging the Gap funding has allowed us to implement a certified diabetes educator for the first time.
I have started diabetes education classes for both English and our Spanish-speaking population so that they can better understand how food is affecting their diabetes. We provide them examples of carbohydrates, but healthy sources of carbohydrates. Understanding how to read a nutrition label becomes really important so that they know what to look for to make healthy food decisions. Every patient deserves the best care that they can get. When I first see a patient, oftentimes it's not just diabetes. They might require help with finding access to healthy food, or maybe they need legal services. And at that time, that's more pressing than getting their diabetes in control. That doesn't get offered at most clinics. I can help kind of hone in on what social determinants of health need to be addressed so that I could refer out to a community health worker.
It really is meeting the patient where they're at and finding out what resources that they could benefit from. A lot of them don't understand diabetes. A lot of them don't understand what carbs are or how they affect their blood sugar. What brought me to your home was your diabetes. We're going to go through your whole social determinants of health to decide if there's something else that is keeping you from being able to take care of your diabetes.
We need funding from multiple streams as about 30% of our population are still uninsured.
We're demonstrating with data and evaluation results to show the positive impact on patients and financial sustainability. We are leveraging existing reimbursement strategies and we're trying to create new financial models. And with support from Bridging the Gap, it provides the opportunity for all of us to try new approaches and really importantly to put the work into evaluating our approaches, and that's a huge contribution for all of us.
When you talk about expanding the model for patients, I believe the funding that needs to line up is enough funding for clinics to keep certified diabetes educators in their clinics. Through Bridging the Gap, we have been able to prove that this model works. We're proving that this is working to improve outcomes.